Let's get to your health at 8. The number of coronavirus cases in this country has topped 130 now, with at least 9 deaths reported.
And unfortunately, it's not likely to stop there. Some schools are now closing at the first hint of possible exposure. So just how vulnerable are children? NBC medical correspondent Dr. John Torres is here to answer some commonly asked questions. But the aspect of this that is about children is kind of surprising because, as I understand it, they haven't really been affected as much as adults have by the coronavirus.
And you're right. That's the one thing I think a lot of people are going to be surprised about. The World Health Organization did a study, and they found out that of the children, this is in China, of the tens of thousands of cases in China, less than 3% were actually in children. And of the children that got infected with the coronavirus, over 98% only had mild symptoms. So it hardly affects children at all. So it's one of those things they seem to have a little bit of protection for. And I'm getting a lot of questions about school closures and things like that. Those are happening out of an abundance of cautions. So this doesn't mean don't send your kids to school. Just when you do, just make sure they know what they need to do.
Do we know why that's the case with kids?
Well, we think it's happening for a couple reasons. One, kids have immune systems that can rapidly adapt and change. So if they get the coronavirus, it can fight it. Plus, they've probably been exposed to other coronaviruses all their life because they get those colds all the time. Those giving them some immunity to this one. So their immune system is a little bit stronger than ours is fighting this off.
You mentioned questions that you get commonly. We've been looked up what people are Googling, okay? One of the Google search trends is, how long can the coronavirus live on surfaces?
And it seems like, according to the CDC, what they're saying is on metal surfaces, we're talking railings and things like that, a couple of hours at the most. Other surfaces, it might be able to last longer, but they're not exactly sure why or sure how long. But one thing to keep in mind, just because it's lasting on the surface doesn't mean that it can infect you, that it's strong enough to infect you. It could be just parts of the dying virus they're detecting. And so, again, the most important thing is to remember it can last for a few hours, maybe a few days in some instances. So just be careful.
Another big question on Google, corona cleaning advice. What are some of the best things that people should be doing to avoid getting the virus?
Number one, wash your hands like we talk about all the time. If you can't get to a sink, use alcohol gel sanitizers, 60% alcohol or above. And when you're around things like that you want to clean the surfaces of, the CDC says just regular household cleaning products. Use those. If you use a tissue, throw it away. Use disposable tissues, not handkerchiefs and things like that you put back in your pocket. And cover up when you cough and sneeze. Just the common sense things we always talk about.
Thank you, Dr. Torres. Appreciate it.